Very good evening, friends. Hello. Yes, very good evening, friends. Meeting again in the session of Materia Medica. And today we're going to start with something new, and that is the study of group remedies. In your syllabus, third year syllabus, there have been 6 groups which are there for your syllabus, and the first group, which is the acid group. And there are many acid remedies in our Materia Medica. If we study the group, then it is easy to recognize the acid remedy. And that's why this group study makes the things simple. If we understand the characteristics of the acids, it is quite easy to reach to the specific acid because we understand in a broad sense very easily about the individual understanding about the patient with the help of group indication. And those things are very, very essential in practice. And that's why today we're going to start a very important group study, that is acid group study. I will share the screen, and this is the PPT which I have prepared for this lecture. Most probably it may take a day or two. So we'll start with the things clearly. Now there will be a PPT in front of you. So, very warm welcome to all of you from the Divine School of Homeopathy for this specific study of the acid group, learning the acid group. We'll start with directly with the session. The topic is perceiving the acid group. Today, we're going to learn something more essential in order to understand very clearly the acids. In acids in homeopathy, they are divided into two parts, the organic acids and inorganic acids. Organic acids are always weak acids because during the process of a reduction process, these acids lose their electron and they becomes weak. Exactly opposite thing happens when an inorganic acids are there. During this process, they gets oxidizing things and they gains the electrons, and because of which they become strong. So we have both varieties in our materia medica, the organic acids as well as the inorganic acids. The few important features about acids are colorless, they are fuming, there are always fumes happens to be there, and third important thing, they are corrosive. These are common characteristics of the acids. The uses of acids, generally it is used as a preservative. It is also used in the medical section as a curative, and it is also used to destruct the things, destruction. So if you go through these things, you can find it out from miasm, from sora to syphilis. So this is very typical. Sora is dominating over there sometimes, but many times it is tubercular to syphilitic. That miasm is very specifically present in acids groups. Organic acids, let's see how many organic acids are there. This is the list which I have made. There is acetic acid, which is prepared from vinegar, a common name. Benzoic acid, it is common name is benzoicum acid. On right side, the common names are given. Butyric acid, it is butyricum acidum. Carbolic acid, phenol group. Citric acid, citricum acidum. Formic acid, formic acidum. Lacticum acidum. Oxalic, it is sorrel acid. Picric acid, picricum acidum. Salicylic acid, same. Tartaric acid, tartaricum acidum. And uric acid, uricum acidum. These are 12 organic acids which are there in our materia medica. And inorganic acid, which are called to be a strong acids, out of them, the 7 are there: the bromic acid, bromium acidum; chromic acid, chromium acidum; fluoric acid, it is hydrofluoric acid; hydrocyanic acid, prussic acid; muriatic acid is nothing but hydrochloric acid; phosphoric acid, phosphoricum acidum; and sulfuric acid, it is vitriol. So there are 12 inorganic and 7 inorganic, total 19 which are there most commonly, which we can see in our materia medica. So let us understand what is common with them. What is the acid personality? Acid personality are the of the person is they are the persons which burns themselves and they burns the others also. They are getting burned themselves at the mental level, at the physical level, and at the same time they troubles the others. Sometimes they are absolutely on one side of the coin, they are absolutely lovable, but when once there is a anger develops, hate develops, they cannot stop from hating. It never comes out, like nitric acid. Hatred for persons unmoved by an apology. So acids, they are the personalities which generally burns themselves as well as others. They desire stimulants. The look is generally angry look. They are quite vindictive. What is vindictive? Vindictive means kunshi. Once they becomes contrary to you, they will never come out of that. The vindictiveness remains persistent throughout. They are debilitated. This is another thing. From the active happy stage, they goes into exactly opposite state. The phosphoric acid is a good example of it. It is phosphorus. As a phosphorus, it is absolutely happy, energetic, lively person. And when phosphoric acid stage comes, the debilitated state of phosphoric acid, exactly opposite. And these are common characteristics of the acid personality, which you can see very easily. These are the personalities where you can find it out, the worn out personalities, the persons who are suffering from chronic pathological states which are gradually developing, making them more and more debilitated day by day. These are the persons which you can catch very easily looking towards them. Yes, this is debilitated. This is cancerous process. This is the process where there is a destruction. Where this is the process there is a gangrene. This is the process there is a cirrhosis. You find it out many pathological processes which are gradually developing and at the same time gradually developing debility day by day. This is acid. Acid you can catch at that specific level. Organic acids, the homeopathic uses, they are slow, they are progressive, they are deep, there are deep pathologies involving the vital organs in the body. So see, the progress is not within a day. It gradually goes on and on. Progressive pathology is there. The cellular changes, the tissue changes, which are there commonly in this personality, very commonly. And you get deep pathologies, a gangrenous process, a process in which cancer is developing, a process in which tubercular adenitis is developing, in a process where the sinus is forming, the fistula is forming. These are the persons where destruction is happening. So organic acids always have such types of pathologies which are chronic pathologies. So all those remedies covers the chronic pathologies. If you will going to learn those pathologies over there in organic acids. And that's why these are the remedies for the chronic pathological conditions. Whereas when we think about the inorganic acids, about the homeopathic uses,
చాక్లెట్స్ ఉంటే పర్వాలేదండి. ఆ 2
మీకు ఒకే పాప, మాకు ఒకే బాబు.
డ్రాయింగ్ చేయడం
నాకు 5 ఇచ్చింది.
Inorganic acids, there is a rapid, acute as well as deep pathologies at the level of skin, mucous membranes, blood, blood vessels. But generally here both types you can get, but more commonly the acute pathologies are much more there with the inorganic acids. So these are the strong acids where you can get such types of pathology. Then the homeopathic indications, acids with homeopathic indication. First and most important, if you start with any acid remedy, the first sentence of acid remedy is always related with this. And what is that? The debility common to all acids is there in this remedy. This is the characteristic of whole acid kingdom. And that is not debility which is there only with the physical level, it is the debility even at the mental level. If you take the example of acetic acid, then there is a personality where you can find it out, debilitated, cancerous, tubercular persons, where sweating is marked, and these are the persons who don't have capacity to do activity. They are having a chronic backache, they are having chronic pain in abdomen, they are the patients of CA stomach, and they feel having the pain better in lying on abdomen. If you think about the phosphoric acid, the diabetes with debility, diabetes with impotency, the debilitated phosphorus is nothing but the phosphoric acid. Every remedy of acid group, you find it out, and there you get this debility, both at the mental level as well as the physical level. And that's why it is necessary to understand this debility first. The muriatic acid is most debilitated. Picric acid, senile dementia, senile weakness, senile prostration. So, debility is always a hallmark of the acid group. And that's what you have to understand first. So, when you look toward the patient and you observe that patient doesn't have that strength which is necessary for him to live, and patient is lying in bed, or patient wants to lie down in bed, patient doesn't want to sit in front of you in the chair, it indicates the debility is marked. Your immediately your antenna show must catch that yes, patient might require acid. These are things which you have to catch very easily, where you can get that specific entity. So many times I have treated the patients in such condition because I understood this acid in the patient. These are the things which you never miss. I have treated one patient in ICU at Nasik, my close relative who was absolutely debilitated, lying like that on the bed in stuporous condition, and he was admitted over there with unconsciousness. All of a sudden, history of little bit followed, but that no one knows exactly the reason. And he was there 8 days in the same condition. And when I saw him, he doesn't have a strength. Even in bed, he was lying like that. His jaw is hanging down. No reaction, so much weakness. I have given him muriatic acid. I took the permission of the physician over there and I said, can I give the homeopathic remedy? He said, why not? Sir, there is no chance. We have already told to the relatives that there are very less chances. Why not to give? After giving muriatic acid, within span of 2 hours, he got conscious. So you can easily catch those things in the patient. Says debility, yes, you have to develop in your mind how the debilitated person is. You catch that at both the levels. Mental debility, you can catch how these persons, how the debilitated mental person will going to talk. They talk in a helpless manner to you. There is no confidence, there is greed, whether to tell or not to tell, whether to talk or not to talk. If they want to talk, they want talks in very mild sense. That is the first important thing. This debility generally happens to be there mostly in old patients or patients who are having chronic disorder, chronic pathologies. They get frustrated because of it. So that is very important characteristic of the acid group. First is debility, the mental as well as physical. You open the nitric acid, there is a debility. You open the phosphoric acid, there is a debility. Everywhere you can catch all those things, and those are very, very essential to know. These things exactly guides you, yes, where the debility is there. Second is the hemorrhagic tendency. And this hemorrhagic tendency is the product of destruction over there. And that's why generally the blood is blackish brown in color. This is again a one important feature one should not forget regarding the acid group. So hemolysis is most common in with the acids, and it might be because of the miasmatic feature, the destructiveness, the syphilitic miasm. Third important thing, how are the pains in acids? The pains are pricking, they are sticking, generally in the throat, at the mucous membrane level, mucocutaneous junctions, at the mouth, at the corners of mouth, that they are cracked and there is a pricking pain or splinter-like pain. Even in throat, the pseudomembrane formation and the pricking pain, splinter-like pain. Or even in rectum, the splinter-like pains, very common with nitric acid. So these are the typical pains of acid group which you can find it out. Then fourth point is sourness in general as well as discharges. Their body is offensive. It looks like sour, as if not washed properly. Whatever the discharges are there, whether the diarrhea is there, whether natural discharges are there, all discharges, they are offensive, whether they are normal or abnormal, all are offensive with the acids. All are sour. So the offensiveness is the characteristic of this specific group. Then another character which comes over there many times, which is the effect of or result of cracks, fissures and fissulas. Basically in the cracks, the burning sensation. If you see nitric acid, there is tremendous burning at the anal region because of fissures, and it burns hours together even after passing the stools. Burning in stomach is the characteristic of acetic acid. Even the burning pains are very sensitive pains which are there with the muriatic acid. So sensitivity specifically showing a burning characteristic is there because there are cracks, and cracks specifically at the corners of mouth, at the mucocutaneous junctions, the fissures at the mucocutaneous junctions, at the anal region, the fissulas, fistula in anode, fistula lacrimalis, dental fistula. Very commonly, they are the products of this acid group. Pseudomembrane formation. The throat, you can get a pseudomembranous formation. They are commonly diphtheria-like membrane, which diphtheritic membrane, pseudomembrane, which develops over there with pricking or splinter-like pains. Then, regarding the discharges, whether they are normal or abnormal, whether it is saliva, whether it is nasal discharge, whether it is diarrhea, whether it is leukorrhea, whether it is whether it is a mm, you can get even menses. The characteristic which you get over there is the acridity. So acridity is very characteristic over there. Discharges, they are acrid excoriating, they are burning the parts. The parts becomes corroded. There is the discharges, they are putrid, pus-like, contains pus, destruction. They are causing burning. They are producing or they are having offensive smell. And lastly, they are hemorrhagic, which contains blackish brown blood. So see, this is whole pathology about the acid group, which you can catch easily in the patients when you look towards such types of pathology. The commonest site of affection is the skin, the mucous membranes, the tissues. And in the skin, mucous membrane and tissues, you get commonly the inflammations. And they are not an acute, generally they are of chronic nature. There are ulcerations, there is gangrene. These are very common things which you can get over there. There is a craving for alcohol, indigestible foods. So, craving for stimulants is very important in acid group. There is an aversion to meat and bread. That is another common feature which you can get with the acids. So see, these are the features which gives you exactly the nature about the acids and indicates the acids. This whole slide defines exactly the how acid presents in homeopathy. So this is one side of the acid which we have discussed. How is the constitution of an acid? The acid constitution, they are thin personalities, generally they are weak, debilitated, broken down. This word is used specifically, that is, they were good earlier and day by day they are destructed. Broken down is nothing but the destructed constitution. The pale anemic, destruction of RBCs, hemolytic and anemia is developed. Shriveled, doesn't have strength, the tone over there. The emaciated, the parts gets thin, emaciated. So this is very characteristically a constitution of acid. There is progressive weakness, prematurely old looks, and this is because of shriveled appearance, the early degeneration, tremendous loss of strength. Day by day, patient is becoming more and more weak, debilitated, is increasing. This is very characteristically a acid constitution. I think it's better to stop over here with this slide because there are many more things which we have to learn. We have to learn the psychological aspect about the acids, and that we're going to learn in tomorrow's session. So, in general, overlook over acid we have done in today's session. We have learned certain aspects of it in today's session. Tomorrow we are going to learn regarding the psychological aspect of the acid and then a few features related with certain remedy. So that's all for today. Thank you being there and meet again tomorrow at the same time, and we'll have a chat tomorrow also. So thanks a lot and good night.
Thank you, sir. Good night.
Thank you, sir. Have a good night.
Good night.